Well, it's been an extraordinarily challenging year. COVID hasn't gone away, and now we've seen runaway inflation happen in this country over the last year. What I always tell people is that our inflation really started late last year. So, as the price of contract labor became five, six times what we're paying full time employees, we had to raise the salaries of a lot of our staff, our nurses and other frontline staff, just to be even a little bit competitive with contract and travel nurses. And so our wage costs went up, and we've seen those that continue over the last year. One of our board meetings, it was a subcommittee meeting, and our auditor told our audit and compliance committee that they were trying to be really mindful, and they were only going to raise our prices by 7% in the next year because of inflation. Well, the problem with healthcare systems and the problem with healthcare right now is we're not getting 7% increases. The price increase from Medicare is much less than that. The commercial payers aren't running to pay us more. And so we're in an untenable situation right now where we have runaway inflation, where we have no price elasticity. If you look at healthcare systems across the country, I think there's about 1,500 healthcare systems, and nobody has more than about a 2% market share. But if you look at the payers, there are only five real payers, right? There's the government, there's Blues, there's Aetna, Cigna, and United. And because they have such concentrated market share across the country, it makes it very difficult for us to compete. And as they put in more pre-authorizations, as they put in more denials, we're not even able to capture payments for services that we're providing. Whenever healthcare systems try to get together to get economy of scale and size, there is a lot of scrutiny on those types of mergers. And again, when you're in a situation where there's essentially five payers but 1,500 health systems, it seems illogical that the amount of attention going on healthcare system mergers versus the size of a company like United Healthcare. And so I think there's got to be a realization, like in all industries, size does matter, and you can get efficiencies and you can deliver more efficient care if you can get critical mass and critical size. So I think healthcare systems need to be allowed to do that.